From the playground to the football field, all those bumps and bruises, or even worse, unfortunately, can happen just like that at a moment's notice. So the question is, what can parents do to help keep their little ones from getting hurt?
So, of course, we're joined by Dr. Chris Minnock with Michigan Orthopedic Surgeons right now to find out. First of all, Chris, thank you for joining us this morning. Schools are back in session. I mean, how often are you seeing kids, older kids, any of that age group, with injuries in your office?
Yeah, this is a busier time of year for us with sports ramping up in the fall and with playgrounds being a lot more active than they were in the summer. We're seeing more falls leading to injuries ranging from sprains and strains to fractures and things we need to kind of protect while they heal.
Yeah, definitely. That I was going to ask you if fall kind of is like the prime time for seeing, more and more students coming in. What do you see most of in terms of playground calls, football practices in full swing, tackle football?
Yeah, those are two of the main areas we see injuries from just the number of kids that are on the playground doing the monkey bars and doing things that may lead to a fall they may not be able to control, where they land on their wrist or twist their ankle leading to an injury. That's a common source. And then, as you mentioned, football and actually soccer, basketball, all of those have their own sets of injuries that we see.
What are the most common injuries that you usually treat or see?
As I said, there's a lot of sprains and strains, but a lot of fractures to the upper extremity, the radius or the ulna bone, or fractures around the ankle are probably the most common areas that we would see.
And for parents, anything that they should be teaching their kids or letting their kids know before they get on the playground or play in those extracurricular sports?
Yeah, it's such a good question.
Yeah, unfortunately, common sense is the most important thing. So if you're not old enough to do a particular playground equipment, probably shouldn't be trying it, especially not with the parent helping you. That being said, I think, kind of using the playground equipment appropriately, not jumping off the top of it or doing things that may
Easier
sound
said
fun
than done, though, right?
Yeah.
or dangerous. Avoiding that would be good.
Yeah. You're going to be the mom or dad that runs out there?
We have a no monkey bars rule. Whether or not anyone listens is another story. But, Chris, what about heat? How often does heat play a role in these injuries?
We can say heat, especially in sports, football in particular, can lead to dehydration and some issues related to just not maintaining enough water intake during the day. So that's something we see. But yeah, I think more of the injuries we see are more kind of falls and that contact from the sports this time of year.
When does it become serious enough to come see you or come see a doctor with the injuries, if it's just a bump or bruise, or is it something more serious?
Yeah, if it's something that's swollen and bruised and is getting more swollen and the child or the teenager is not willing to use it, probably something we should x-ray to check it out. But if it's something they're moving and doesn't seem particularly swollen or bruised, that's something you can wait a day or two and see how it does.
What about a message for parents to their kids? Because I remember when I was a kid, maybe you guys were the same way, but I wouldn't want to tell my parents. I'd be either embarrassed or I didn't want them to be mad at me that I hurt myself.
Yeah.
What should they be teaching their kids? Like, hey, you need to come talk to mom or dad if something happens.
Yeah, I think even if it's a more minor injury, there are things you can do to get rid of the inflammation or at least make you feel better, even if it's not something that needs to be checked out. So even basic stuff like icing, elevating, compression, that'll help a lot in the short term.
All right, great tips. Thank you so much. We appreciate it, especially this time of year.
Yeah, thank you for having me.